The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome once again to Question Lab. Tonight's topic is high-yield physiology, and leading tonight's session once again is Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm currently working in dermatology, and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare you all for the USMLE Step 1, Step 2 CK, as well as other exams, and I'm happy to help lead tonight's session.
I know I mentioned RX Coach earlier. RX Coach is our new coaching and tutoring program, and we work with students one-on-one to help them on their academic journey. We'll talk more about that later, but what I do want you to know for now is that the methodology that we'll use tonight is very similar to the methodology that we use in RX Coach. And so without any further ado, let's go ahead and get into our first question of the evening. As you can see, the answer choices have been covered up. That is by design. We don't want the answer choices to guide or dictate your thought process. We don't want you to see an answer choice that you are unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. So we've gone ahead and removed those for you. After that, we'd like to begin with the lead-in, which is the last sentence or the question itself. And we do that so that you know what the test writer is asking when you read that vignette, so you don't have to reread that question and waste valuable time on test day, but also so you can pick up on all those relevant clues. So let's go ahead and take a look at that lead-in together. Which of the following results will most likely be seen after administration of a low dose of angiotensin II? Which of the following results will be most likely seen after administration of a low dose of angiotensin II? After that, we'd like to ask our students how many steps they believe the question will require. An example of a one-step question is when you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question is when you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, we'd love to hear from you in the question box. Let us know, how many steps do you think this question will require? And then we'll read that vignette. All right, I see some responses coming in. Let's go ahead and take a look at that vignette. A renal physiologist is studying the effects of various substances on the renal arterioles and the glomerular filtration rate, or GFR. Which of the following results will most likely be seen after administration of a low dose of angiotensin II? We'd like all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this question and vignette. And as Sean had read with that lead-in, we kind of already have a sense of this as somewhat of a research study. And we can tell that this is a very short vignette. There's essentially only one sentence, and they're asking us to basically figure out how these various substances are going to change a few things. And we can see there in the columns in that table what really those three variables are: afferent arteriole, efferent arteriole, and the tone of both of those, as well as the GFR, okay? So we kind of already know what the basic premise of this question is going to be, okay? And the main thing that they're asking us, as the lead-in suggested, was angiotensin II. What effects are we going to see after we administer that? But importantly, not just angiotensin II, but a low dose of angiotensin II. And maybe that's different than a high dose. There are certain other compounds, as we're aware, dopamine, epinephrine, norepinephrine, that can have various effects that are different depending on if it's a low dose, a medium dose, or high dose. So that's also important to keep in mind. So let's go ahead and let's take a look at our answer choices. And as you can imagine, there are going to be 5 answer choices here, okay? And as you can see, each column has a different up arrow, down arrow, or no change, and also not just that, but also the intensity. So there's 2 up arrows or 2 down arrows, and that means it's a bigger, greater effect. So it's important to understand those different symbols and what they mean. Okay. Now, when we work with students and we go through these answer choices, we actually recommend, that students kind of start at the bottom and work their way up to the top. Okay, so start with answer choice E and work your way up to answer choice A. Now, this is a little bit of a different question because it's more of a diagram question than text, but I think the same principle applies here, because a lot of times we'll see students who start at the top, they'll see something they like and they'll select it without going through all the answer choices. Now, especially in a question where there's 3 components to each answer choice, you want to make sure you're not skipping over any answer choices, okay? So let's go ahead and we'll kind of walk through these individually. So answer choice E, the afferent arterial tone increases, the efferent tone increases. We see 2 up arrows, GFR increases. Answer choice D, afferent tone is no change, efferent tone is increased, GFR is increased. Answer choice C, the afferent tone is increased 2 up arrows, efferent tone is increased, GFR is decreased. Answer choice B, the afferent tone is decreased, the efferent tone has no change, the GFR is increased. Lastly, answer choice A, the afferent tone is decreased, the efferent tone is decreased. We see 2 down arrows there, and the GFR is also decreased. So we'll leave this up for a few more seconds. Make sure you guys get a good look at those answer choices and which way those arrows are headed. And in a few seconds, we'll go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Excellent. Thank you, Paros. Yes, we'll leave this up for a few more seconds here so you can get a good look at your answer choices, and then we'll open up that poll. So take a look here and try to lock or hone in on one answer. All right, I'm going to go ahead and open up that poll here, and hopefully you've had a good chance or enough time here to take a look at those answer choices. We'll go ahead and open up that poll and give all of you a few moments here to submit your responses. Great, I see responses coming in. We'll give all of you a few moments here. All right, about half of you have submitted your responses. We'll give all of you a few more moments here. All righty, well, let's take a look and see what you selected. Looks like answer choice D was the most popular one, with 37% of you selecting D. And second place with 21%, we had answer choice C. So let's take a look and see what the correct answer is. And the correct answer is E, and 16% of you got it right. So definitely a challenging question. Let me hand it off to Paros.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on. And this is a very high yield topic within physiology. They love asking about GFR, afferent, efferent tone, things that vasodilate it, things that vasoconstrict it. So very important to understand this concept, okay? Now, the afferent and efferent arterioles, and actually let's move to the next slide so you guys can get a nice graphic of that glomeruli, the afferent and efferent. The afferent and efferent arterioles basically regulate the hydrostatic pressure in the glomerular capillaries, okay? When that pressure increases, your GFR increases as well, okay? So if you were to increase both the afferent tone, increasing the tone of the afferent arteriole would lower your hydrostatic pressure, okay? If you were to increase the tone of your efferent arteriole, that would increase hydrostatic pressure, okay, and thus GFR. So now the question is, what does angiotensin II do, okay? Now, angiotensin II in low doses constricts both the afferent and efferent arteriole, okay? But you can see it in the very bottom, right underneath that text of efferent arteriole, it is preferentially constricting the efferent arteriole, okay? And that's how ACE inhibitors work. So angiotensin II in low doses constricts both the afferent and efferent arteriole, but its effect is greater on the efferent arteriole. And that's why we had 2 up arrows in answer choice E. So because of that, we're going to have an increase in GFR, okay? In contrast, if you have high doses of angiotensin II, that leads to a more vasoconstriction of the afferent arteriole, so then you would actually have a drop in GFR. So it is actually important that fact that they're telling us low dose. So let's go back, let's take a look at those other answer choices, okay? And hopefully now you can see why E is correct, because angiotensin II in low doses does constrict both the afferent and afferent arterioles, so the tone is going to be increased, but it's greater in the efferent. And as a result, your GFR is going to increase because you have more pressure, more hydrostatic pressure. Answer choice D is saying that there is no change in afferent tone, which is probably something that was selected highly, but angiotensin II actually does affect both afferent and efferent. It's just which one predominates at which dose, okay? Answer choice C, that would be more consistent with higher dose angiotensin II. Answer choice B is incorrect because it's saying there's no change on efferent tone, which we know is false. Then lastly, answer choice A is also false because it's saying that the tone or the constriction is decreased in the arterioles, and we know that's not the case with angiotensin II, which is a potent vasoconstrictor. So definitely a tough question here. Hopefully that helped explain a little bit of angiotensin II effects.
Well, thank you very much, Paul. It's definitely a challenging question. Let's move on now to our second question of the evening. Once again, as you can see, the answer choices are covered up. That is by design. And we will, like always, begin with that lead-in. Which region on the nomogram best represents the patient's most likely acid-base status? Which region on the nomogram best represents the patient's most likely acid-base status? So we'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to that vignette. All right, give all of you a few more moments here. All righty, well, let's go ahead and take a look at that vignette. A 25-year-old man is brought to the emergency department with altered mental state. Pulse is 60 per minute, respirations are 6 per minute, and blood pressure is 109/70. He is only responsive to pain but can move all extremities. The examination shows small pupils and track marks on his forearms. The nomogram shows blood pH on the x-axis and arterial bicarbonate concentration on the y-axis, and blood PCO2 on the curved lines. Which region on the nomogram best represents the patient's most likely acid-base status? Boris.
Thank you, Sean. So what we're going to do is we're going to show you what we think are the important clues in this vignette and lead-in, okay? Now we know from Sean reading that lead-in that this is asking about acid-base status, okay? So we definitely want to pick up on those clues in the vignette that could be altering any sort of acid-base status in the patient, okay? So we have a little bit of a more clinical question now. So we have a 25-year-old man, and usually with these questions that are clinical, they will often give you demographics first. So you definitely want to make note of that because that can automatically clue you in as to certain things that can be going on. Is this an elderly patient, a young patient? We see this as kind of a younger patient, a 25-year-old male, but he has altered mental status. That's what's bringing him in. That's his presenting signs and symptoms, okay? Now, right off the bat, they give us some vital signs, so you definitely want to make note of those, figure out if those are normal, abnormal. They're giving us some physical exam findings, some abnormal findings there, some small pupils, some other things. And then we can see there this nomogram. And this is kind of a newer nomogram. This is not your typical curve that you've seen. and we'll kind of talk about that a little bit later, but they kind of describe what the various axes are, the x-axis, the y-axis, and the curved lines, okay? So you want to make sure that you're kind of understanding what that nomogram is. We'll talk more about that towards the end. But this question is then asking us which region on the nomogram best represents what this patient most likely has in regards to his acid-base status. So I think we've got a couple questions here, a couple steps. I think one, we've got to figure out what is this patient's acid-base status, okay? Acid-base abnormality, if there is one. Two, we then need to figure out where on that nomogram we would plot that, okay? And there are a couple, things with that we need to make sure we figure out that nomogram, but I think this is, for the most part, a two-step question, but kind of an intensive second step there, okay? So let's go ahead and let's take a look at these answer choices. We see that there are 6 regions on the nomogram, but for purposes today, we have 5, and actually we'll keep this here for a few seconds so you can get a closer look at those axes and the curves and what those mean. And you can see that there are 6 regions, but for purposes today, we have 5 answer choices. So we've eliminated one of those regions as an answer choice. So make sure you are keeping note of that. As you can see here in those answer choices, and once again, we're going to start at the bottom and we're going to work our way up to the top, that we've actually eliminated region C, okay? So we'll take a look at those answer choices. Don't worry, that nomogram will still be there in the bottom right. But make sure you're taking a close look at the answer choices. See that answer choice E is actually talking about curve or region F. D is talking about region or curve E. C is talking about curve or region D. B is talking about curve B, and A is talking about curve A. So make sure you don't get that mixed up as well. We'll go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Pars. I'm going to go ahead and open up that poll right now and give all of you a few seconds here to submit your responses. As always, we'll wait until about 2/3 of you have responded. So here's the poll, and we'll wait until you have submitted and locked in your answers. All right, I see about 40% of you have submitted your answers. We'll give all of you a few more moments here. All right, well, let's take a look and see what all of you selected. 39% of you selected curve E, and in second place, we had curve D. So let's take a look and see what the correct answer is. And the correct answer is indeed answer choice D, which is curve E, and 39% of you got it right. So great job. Let me hand it off to Pars.
Thank you, Sean. Yes, great job with this question, and I'm glad you guys weren't thrown off by that nomogram, okay? So let's take a look at that question. Now, whenever, maybe some of you guys have seen this type of nomogram before, but whenever you're given a curve or a graphic that you've never really seen before, it can be very intimidating, especially when you're talking about physiology, cardiac or respiratory physiology. But the test writers are kind of, they kind of know that. They know that it's not a common diagram or nomogram. So basically, it's not going to be super complicated. They basically want you to do your best in a very short time to interpret that. And the best way to do that is to always look at the axes. Always look at the x-axis, the y-axis, the curve axis. Make sure you understand those first, okay? Otherwise, you're going to be completely lost, and then it starts to get intimidating. But if you can make sure that you focus on those axes, you then know what they're asking for. Essentially, all you need to do is just kind of plot a point on that graph and see which region it sticks in, and then you've got an answer choice, okay? So don't be overwhelmed. Just use what you know. and make sure you're using, taking a look at those axes. So in this question, what's going on here? Well, we've got a patient who most likely has opiate overdose, okay? He's a young male, but he is only breathing 6 respirations per minute, okay? He's got track marks on his forearms indicating potential drug use. He's got small pupils as well. All of these suggest maybe an opiate overdose, okay? So if we take a look at the next slide, taking a look at that really nice flow chart in first aid about our acidosis and alkalosis, you can see there on the left, respiratory acidosis. One of the common causes of that is opioids, okay? That can cause hypoventilation, like our patient. He's only breathing 6 breaths per minute. That can lead to respiratory acidosis like our patient, okay? And most likely, this is acute, okay? An acute respiratory acidosis due to opiate overdose, okay? So let's take a look at the next slide where we take a look at what happens to our pH, our CO2, and our bicarb in these settings, okay? Now we're gonna go and we're gonna look at respiratory acidosis. It's an acidosis, so that pH is gonna go down, okay? And it is because of an accumulation in CO2 because you are not ventilating properly. You are hypoventilating. So CO2 is gonna accumulate, it's gonna increase, okay? Now with time, and you can see that the arrow is red, for bicarbonate, we have an upward arrow that is red. So that means with time, our body is going to try to hold on to some of that bicarbonate to help correct that low pH. But that's more of a chronic compensation. That's not something that's going to happen very acutely, like someone who's coming in with an acute opioid overdose, okay? So if we go back to our question in our vignette, we take a look at that nomogram. We're going to see here, we're first going to look at that x-axis. We're going to look for acidotic pHs, okay? And that would be region D, E, and F, okay? We're then going to look at CO2, and that is the curve, okay? Because we know that CO2 accumulates in respiratory acidosis. So of D, E, and F, really only E and F have an elevated CO2, and we're now looking at that curved lines there, okay? But we can see there that the one difference between E and F is that bicarbonate concentration. F has a much higher bicarbonate concentration than E. E is kind of more in that normal range. F is when bicarbonate has started to increase to compensate for acidosis. So that tells me that F is more of a chronic respiratory acidosis, while E, as you guys selected, is more of an acute respiratory acidosis. So that's a quick and simple way to kind of work through these nomograms. Answer choice A and B, like you guys talked about. A is metabolic acidosis, B is respiratory alkalosis, and we can see that by alkalotic pHs. So great job on this question and dissecting that nomogram.
Well, excellent. Thank you very much, Bar. It's definitely a challenging question. You know, if you're studying right now and you're having issues with certain types of subjects or questions, or if you're telling yourself or thinking, you know, I'm studying, but my results just aren't matching my efforts, or what can I do to become even better, or how can I work on my test taking skills, or how can I work on my knowledge gaps and bridge them? You know, we have a lot of students that come to us and say, you know, my friend said to do this, or I read this online, or I read this on Reddit, and what worked for your friend may very well work for them, but may not necessarily work for you. And that's simply because everybody is different. We all learn differently, we all think differently, we have different learning styles, different ways of applying what we know, and different ways of thinking as well. So here at RX Coach, what we'd like to do is focus on you as an individual. And we'll focus on your learning style, your strengths, your weaknesses, and personalize a study plan and set you up for success. We'll work with you to bridge those knowledge gaps and identify them. We'll work with you on your test taking skills. And students always tell us, and one of the things we always hear is that ever since students started working with us, their studying became more efficient and they saw results much more quickly than they anticipated. So if you want to work with a coach, have somebody dedicated to your success that's going to work with you individually and help you on your academic journey, be it med school exams, NBMEs, or comprehensive exams, or even board exams, reach out to us at rx-coach or rx-coach.com. Click on that free consultation tab so we can talk about our coaching program and how it can benefit you. We've had a lot of success with our program, and we'd love to make you one of our success stories as well. So once again, that's rx-coach.com. So with that, let's go ahead and get into our third question of the evening on the topic of physiology. As always, we will begin with that lead-in. Which of the following renal effects is most likely to occur in this subject? Which of the following renal effects is most likely to occur in this subject? We'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require, and then we'll move on to that vignette. All right, a few more seconds here. Let's take a look at that vignette. As part of a research study, a healthy subject is given 1 liter of 5% dextrose in water and renal physiologic effects are assessed. Which of the following renal effects is most likely to occur in this subject? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, and as Sean had read in that lead-in, again, we've got another kind of a research study type question. And they love asking questions like this to assess your understanding of physiology, because this way they can kind of manipulate things, even outside of what you might see normally in a human, to make sure that you understand how things would change physiologically. So that's why they love asking these types of questions. So you want to make sure that you, one, are understanding the experiment, but two, kind of know how things are going to change. And that's really what they're assessing, okay? So they're saying that a healthy subject is given 1 liter of 5% dextrose in water, and then they are assessing the physiologic effects of the kidney. This question, it's a very short question, it's asking about what renal effects are most likely to occur. So I think one, this is probably a one-step question. I think, what renal effects happen if you give a patient 5% dextrose in water? Okay, now obviously it's a little bit more complicated physiologically, but one step is, I think, the right number of steps here. So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, stimulation of osmoreceptors in the hypothalamus. D, increased renal glucose excretion. C, increased plasma osmolarity. B, increased aquaporin channels in the collecting duct. And A, decreased reabsorption of urea from the collecting duct. So we're going to go ahead and open up that poll. Go ahead and select what you think is most likely to occur in this subject. We will talk about it in just a few seconds.
Well, thank you very much, Boris. The poll is now open, and as always, we'll wait until about 2/3 of you have responded. See some responses coming in. We'll give all of you enough time here to lock in those answers. As always, we do have a raffle and special offer, so make sure you stick around until the end, because one of you may be our lucky winner and you must be present to win. All righty, a few more moments here. Let's go ahead and take a look and see what you selected. 33% of you selected increased plasma osmolarity, and 22% of you selected increased renal glucose excretion. So let's take a look and see what the correct answer is. And the correct answer is A, decreased reabsorption of urea from the collecting duct. So definitely another challenging physiology question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on here, okay? So if you were to give a healthy subject 5% dextrose in water, that's basically kind of giving them pure water. That dextrose is essentially a sugar, and that's going to be metabolized. So you're basically giving a subject a lot of water, okay? And if you give a patient water, that would decrease their osmolality in the serum, okay? As a result, this would lead to suppression of ADH secretion, because remember, ADH helps reabsorb water. We don't want to reabsorb more water. We just gave ourselves 1 liter of water, okay? So let's take a look at the next slide. Let's take a look at ADH, okay? So we just said that giving ourselves 1 liter of this would suppress ADH, and remember, ADH is its primary function is regulation of serum osmolality, okay? And it does so by regulating aquaporin channel insertion in the renal collecting duct, okay? Now, a second effect of ADH is to also increase urea reabsorption, okay? And that helps maintain the interstitial concentrating gradient, which allows water to be reabsorbed from the tubules in the first place, okay? So let's take a look at the next slide where we take a look at that collecting duct. And this is really getting into the physiology of the collecting duct here, but you can see here on the left side in that text area, kind of that third bullet point, that ADH acts at the V2 receptor, and it leads to insertion of aquaporin channels. It also leads to urea reabsorption. So if we are suppressing ADH secretion, because we just had 1 liter of water put in, we're going to have decreased aquaporin channels put in, and we're going to have decreased urea reabsorption, okay? So let's go back to our question and our answer choices. Now, hopefully you can see why answer choice A is the best answer, okay? We have decreased reabsorption of urea from the collecting duct. Answer choice B is half correct. The aquaporin channels are affected, but it's a decreased aquaporin channels, not increased. Okay, so answer choice B is kind of flipped. Now the other answer choices, in case you selected that, answer choice E is if we had increased serum osmolality or osmolarity. In this case, we have a decrease. Answer choice D, kind of not too much playing a role here, more if a patient were diabetic and had saturation of their receptors. Increased plasma osmolarity, we just said that this is decreased, okay? And one of the ways you can also, if you didn't know exactly that ADH led to reabsorption of urea, you can see there that some of those answer choices kind of all go along with increased osmolarity. So answer choice C, answer choice E, answer choice B, those were all to be the case and correct if plasma osmolarity were increased. And we know we can't have 3 correct answers here, okay? So the answer choice, the best answer choice here is A.
Well, thank you very much, Pars. Definitely another challenging question. We've got 1 question left tonight, so let's try to finish strong. As always, the answer choices have been removed. That is, as you know, by design, and we'll begin with that lead-in. Which of the following left heart physiologic changes is most likely in this patient? Which of the following left heart physiologic changes is most likely in this patient? We'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll move on to that vignette. All right, a few more moments here. Let's go ahead and take a look at that vignette. A 40-year-old man comes to the clinic with increasing shortness of breath. He says it is worse with exercise and when lying down to sleep. Blood pressure is 130/60. An early diastolic murmur is heard at the left sternal border with the patient leaning forward. Which of the following left heart physiologic changes is most likely in this patient? We want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Pars.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. This is the 4th time doing this, so hopefully you guys are starting to get a sense of what are those important clues in those physiology questions to really pick up on and make sure you get that question right, okay? So now we've got a 40-year-old male, and he's got increasing shortness of breath. Okay, so when you have shortness of breath, you want to ask some questions, what makes it worse, what makes it better? You want to do a physical exam, and they're telling us some things that make it worse, and also some abnormal physical exam findings, okay? So what left heart physiologic change is most likely? So I think, one, we've got to figure out what is going on in this patient, what's the condition, what's the diagnosis, and then two, what is happening to that patient's left heart physiologically? So what is something we might see going on there? So I think we've got a nice two-step question here. So let's go ahead and let's take a look at those answer choices. Once again, starting at the bottom and working our way up to the top. Answer choice E, increased stroke volume with decreased flow through the aortic valve. D, increased stroke volume and end diastolic volume. C, increased end systolic volume with decreased stroke volume. B, increased atrial pressure with low end diastolic volume. And A, decreased end diastolic volume with ventricular wall thickening. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
All right. The poll is open. We'll wait until 2/3 of you have responded. And of course, we're going to have a raffle and special offer. Next week's topic is biochemistry. I hope you'll join us. We do these question labs every Tuesday at 8 p.m. Eastern. All righty. About 20% of you have submitted your responses. We'll give all of you a few more moments. All righty. Looks like we're almost there. Looks pretty close here. Let's take a look and see what you selected. 29% of you selected answer choice C, which was increased end systolic volume with decreased stroke volume. And 22% of you selected answer choice B. Let's take a look and see what the correct answer is. And the correct answer is D, increased stroke volume and end diastolic volume. So another challenging question. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely another tough question, but very important in cardiac physiology they love to ask about. So let's take a look at this question, okay? So what's going on here? We've got a patient who is having increased shortness of breath, okay? And as a result, he has issues when he's lying down, okay? On top of that, we see there about a murmur, okay? We see that there is a diastolic murmur, okay? And it's best heard the left sternal border with the patient leaning forward, okay? So this is an early diastolic murmur. So let's take a look at the next slide, okay? And if we take a look at that next slide, we can see that one of our diastolic murmurs is aortic regurgitation. You can see there in that diagram that the intensity of that murmur is very early after that second heart sound, okay? It's an early diastolic murmur. And you can hear it, as you can see, along that left sternal border, okay? So a lot of clues here pointing to this being aortic regurgitation, okay? Now you can see there are some of the causes of aortic regurgitation: a bicuspid aortic valve, endocarditis, rheumatic fever, okay? And also on top of that, you can see there in that clinical association, it talks about a wide pulse pressure, okay? A wide pulse pressure is when you have a wide difference between your systolic and diastolic blood pressure, okay? Now if we take a look at the next slide, so one more slide, we can see what aortic regurgitation does, okay? So what this means, this is a diastolic murmur. This means that blood is kind of seeping back into that left ventricle, okay? There's a backflow of blood into the left ventricle from the aorta, and this is during diastole. So what that means is we have more blood in our ventricle at the end of diastole. So our end diastolic volume is going to increase, okay? And so what does that mean? Well, now if we have more blood in our ventricle is going to try to pump out as much of it as it can. So our stroke volume is going to increase as well, okay? Our ventricle is pumping out more blood because there's more blood in the ventricle to begin with, okay? So we have an increase in end diastolic volume and an increase in stroke volume, okay? So hopefully you guys understand why that's happening in aortic regurgitation. Let's go back to our question and vignette. You can see there, again, early diastolic murmur, best heard at the left sternal border. On top of that, we see that blood pressure is 130/60. So we've got a little bit of a widened pulse pressure, all consistent with aortic regurgitation. And now we see that answer choice D, like we talked about, really fits with what would happen in AR. Answer choice E is getting at mitral regurgitation, okay, which we would expect more of a pansystolic murmur. Answer choice C, that is getting at aortic stenosis, and that is a systolic murmur, so we know that's not right. Answer choice B is talking about mitral stenosis, which would show more of that diastolic rumble that you would hear at that apex. Lastly, answer choice A, this is kind of talking about left ventricular hypertrophy, so a little bit of a different issue there as well. So great job on these pretty high yield but tricky physiologic concepts today. I will pass it back to you, Sean.
Well, thank you very much, Bowers. Definitely some challenging questions tonight. If you want to review these questions on your own time, feel free to take a picture or screenshot or make note of these QIDs. You can simply log into USMLE-Rx and type these into the Rx search field, and these questions will pull right up, and you can review them more on your own time. So I'll leave this up for a few seconds here to give you enough time to make note of these.